Health insurance coverage is an important measure of our nation's overall well-being. Whether it's illness, injury, or preventative needs, health insurance provides greater access to medical care, protection from high unexpected costs, and more economic stability. Each year, the Census Bureau provides data on health insurance coverage. We look at who is and isn't covered, where they live, and what type of insurance they have. Policymakers use this information to make data-driven decisions.
This is Larissa Makita, Health and Disability Statistics Branch Chief, and I'm here to present today's findings. The health insurance estimates released today come from two surveys. The Current Population Survey Annual Social and Economic Supplement, or CPS-ASEC, asks people about their health insurance coverage at any time in the previous calendar year. The national level results presented today come from this survey. Today's CPS-ASEC health insurance estimates are based on the updated processing system. These health insurance estimates should only be compared directly to estimates based on this updated processing system. State-level estimates released today come from the American Community Survey, which asks people about their coverage at the time of the interview. Due to its larger sample size, the American Community Survey is the recommended source of health insurance statistics for smaller populations and levels of geography. Let me begin by summarizing the main findings this year. An estimated 8.5% of the population, or about 27.5 million people, did not have health insurance coverage at any point in 2018. Between 2017 and 2018, the uninsured rate increased 0.5 percentage points, and the number of uninsured people increased by 1.9 million. This represents the first year-to-year increase in the uninsured rate in the CPS-ASEC since 2008 to 2009. The percentage of people uninsured at the time of their interview decreased in 3 states and increased in 8 states between 2017 and 2018. In 2018, most people, 91.5%, had health insurance coverage at some point during the calendar year, with more people having private health insurance, 67.3%, than public coverage, 34.4%. Looking at private coverage more closely, employer-based insurance was the most common subtype of coverage overall, covering 55.1% of the population. 10.8% of people purchased their coverage directly. The updated processing system allows us, for the first time, to distinguish whether this coverage was through a state or federal health insurance marketplace, such as healthcare.gov. In 2018, 3.3% of people, or 30.8% of people with direct purchase insurance, obtained their coverage through the marketplace. In 2018, 34.4% of people had public coverage, which includes Medicare, Medicaid, and VA and CHAMP VA coverage. Over time, changes in the rate of health insurance coverage and the distribution of coverage types may reflect economic trends, shifts in the demographic composition of the population, and policy changes that affect access to care. The percentage of people covered by any type of health insurance decreased 0.5 percentage point between 2017 and 2018. This decrease was primarily driven by a change in public coverage. Between 2017 and 2018, the percentage of people with private coverage did not statistically change, and the percentage of people with public coverage decreased 0.4 percentage points. Among public coverage, Medicaid coverage decreased 0.7 percentage points, while Medicare coverage moved in the opposite direction, increasing by 0.4 percentage points. This increase was partly due to growth in the number of people aged 65 and over, and not a change in Medicare coverage for adults in this age range. Age is strongly associated with the likelihood that a person has health insurance. In 2018, adults aged 65 and over had the lowest uninsured rate, 0.9%, followed by children under the age of 19, 5.5%, and adults aged 19 to 64, 11.7%. Between 2017 and 2018, the uninsured rate increased for adults aged 35 to 44 and 45 to 64, as well as for children aged 0 to 18. Indeed, in 2018, 5.5% of children under the age of 19 did not have health insurance coverage, a 0.6 percentage point increase from 2017. For many selected characteristics, The percentage of children without health insurance coverage was significantly higher in 2018 than in 2017. However, the change was not uniform across groups. For example, the uninsured rate did not change for children and families with income of less than 400% of poverty. However, it increased 0.7 percentage points for children living in families at or above 400% of poverty. In both years, the rate of uninsured declined as the income to poverty ratio increased. The updated processing system allows us to report more detailed information than previously available, including subannual or within-year health insurance coverage. Among the 296.2 million people covered at any point during 2018, most, 96.4%, had health insurance coverage for all 12 months, while 3.6% had coverage for 1 to 11 months. That is, most people with coverage during 2018 had coverage throughout the entire calendar year. Most people with private coverage and with public coverage also had their coverage for all of 2018. The larger sample size of the American Community Survey allows us to observe the uninsured rate as well as changes in the uninsured rate at the state level. This map shows the uninsured rate by state in 2018. Lighter colors represent lower uninsured rates, and darker colors represent higher uninsured rates. 6 states and the District of Columbia are in the lightest shade of blue, with less than 5% of people uninsured at the time of interview. 6 states in the darkest shade have an uninsured rate of 12% or higher. This map presents the change in uninsured rates. Between 2017 and 2018, the percentage of people without health insurance coverage decreased in 3 states and increased in 8 states. Statistically significant decreases ranged from 0.3 to 1.8 percentage points, and all increases were 1 percentage point or less. More information is available in our reports and online. We have a number of tables and figures on our website, in addition to an America Counts story that looks at changes in coverage for children, and a Research Matters blog that highlights a new measure of health insurance coverage at the time of interview, that we include in our report for the first time this year. Additional data products based on the American Community Survey will be available on September 26th.